The treatment of choice for bladder stone is A. Transurethral litholepaxy, B. Percutaneous suprapubic litholepaxy, C. Vesicotomy and stone retrieval, D. Intravenous antibiotics. Transurethral cystolitholepaxy is the most common procedure used to treat adult with the bladder stones. If it is a small stone, you will do ultrasound lithotripsy. If it is a large stone, you will do laser lithotripsy. So the correct option here is transurethral litholepaxy. What is the main hazard of ectopic testis? A. Impotence. B. Carcinoma development. C. Liable to injury. D. Hernia development. The main hazard of ectopic testis is it is liable to injury. So the correct option here is C. Liable to injury. Which of the following are the treatment options for cystocele? A. Anterior colporrhaphy. B. Transvaginal tape. C. Transobturator tape. D. All of the above. Now, traditionally, the anterior vaginal wall repair, anterior colporrhaphy was done. Now it is replaced by vaginal inserted tape, that is TVT, transvaginal tape, or transobturator tape, or mesh. So the correct option here is all the options are correct. So all of the above. Best time for surgery for hypospadias is at what age? A. 4 to 6 months when you will do the surgery. A. 0 to 4 months. B. 4 to 6 months. C. 6 to 10 months. D. More than 2 years. This operation for hypospadias are routinely performed when the patient is between 6 to 18 months of age. The infant has good tolerance to surgery and anesthesia by age 6 months. The child is well aware of his genitalia and toilet training by the age of 18 months. So the most suitable age for the operation of hypospadias is between 6 and 18 months. The degree of hypospadias dictates the need for repair. If the opening is coronal, which is 85% of patients, the penis is usually functional both for micturition and procreation, and repair is mainly done for cosmetic reasons. Openings that are more proximal on the shaft require correction to allow voiding while standing, normal erection, and proper sperm deposition during intercourse. The commonest procedure for distal hypospadias is tubularized incised plate urethroplasty, while the techniques that utilize the forescreen are commonly used for more proximal hypospadias. Now, what are the complications of hypospadias surgery? Urethro-cutaneous fistula, it is the most common complication. Recurrence of chordae, urethral stricture, meatal stenosis, and infection. So the best time of surgery for hypospadias is 6 to 10 months. Which enzyme is of diagnostic importance in chronic pancreatitis? A. Amylase. B. Pancreatic polypeptide. C. Lipase. D. Serum interleukin 6 level. Now, elevated lipase levels are more specific to pancreas than elevated amylase level. Lipase levels remain high for 12 days. In patients with chronic pancreatitis, lipase levels may be elevated in presence of a normal serum amylase level. So the correct option here is lipase. Modified Koch Whipple's operation is devised to preserve which part of stomach? A. Fundus. B. Body. C. Lesser curvature. D. Pyloric entry. This modified cost Whipple operation is also called as pylorus preserving pancreaticoduodenectomy (PPPD) or PP cost Whipple's operation procedure. It is a procedure of choice for most adenocarcinoma of head of pancreas. The original pancreaticoduodenectomy as proposed by Whipples included resection of gastric antrum. The Whipple's procedure is now reserved for situations in which entire duodenum has to be removed, or where the tumor encroaches on the first part of duodenum or distal stomach, and PPPD would not achieve a clear resection margin. So the correct option here is D. Pyloric antrum. Pseudocyst of pancreas is developed in how much duration following an attack of acute pancreatitis? A. Less than 1 week. B. Less than 2 weeks. C. 3 or more weeks. D. 4 or more weeks. It is 4 or more weeks. True of umbilical hernia is A. Most common content is large intestine. B. Most of the umbilical hernias disappear spontaneously. Males are affected more than females. Uncomplicated hernias are repaired at 1 year of age through infraumbilical incisions. The correct option here is B. Most of the umbilical hernias disappear spontaneously. Treatment of congenital hydrocephalus is A. Ventriculoperitoneal shunt. B. Stereotactic radiosurgery. C. Diuretics. D. Radiotherapy. It is ventriculoperitoneal shunt. How much percentage of blunt trauma injuries to spleen in adult are currently managed non-operatively? A 30%, B 50%, C 80%, D 90%. It is 80% of the blunt trauma injury to spleen are managed non-operatively. Surgery is not required. Which of the following is false about Jenker's diverticulum? Most patients are about above 50 years of age. It is most common esophageal diverticulum. Mucosal outpouching through Killian's triangle. Cervical webs can be associated with Jenker's diverticulum. Downhill esophagus varices develop as a result of obstruction seen in A. Portal vein, B. Hepatic vein, C. Superior vena cava, D. Inferior vena cava. Superior vena cava. Pantolon hernia is also called as A. Dual hernia, B. Saddleback hernia, C. Botchdalak hernia, D. Retrosternal hernia. It is called saddlebag hernia. Pantaloons hernia is also called as saddleback hernia. Rolled up omentum is seen in cases of A. Peritoneal tuberculosis, peritoneal metastasis, perforation peritonitis, malrotation of gut. It is peritoneal tuberculosis. Treatment of choice for low fistula in ANO is A. Fistulotomy, B. Intravenous antibiotic, C. Stage surgical. Fistulotomy. Colonoscopy are not indicated in A. Meant to be, B. FAP, C. HNPCC, D. Concat Canada syndrome. It is meant to be. Simplest investigation to be performed in suspected cases of gastric carcinoma is A. Double contrast radiography, B. Plain radiography, C. CT scan, D. Endoscopy. It is CT scan. Plunging ranula is a cystic growth of sublingual gland, a lymph node, a tumor in the floor of mouth. It is a cystic growth of sublingual gland. Most common site of direct hernia is Hasselbalch triangle, femoral gland. It is Hasselbalch triangle. Treatment of contaminated wound of lung is debridement and antibiotics, hyperbaric oxygen, amputation. It is debridement and antibiotics. Most important diagnostic feature of congenital hypertrophic pyloric stenosis is metabolic alkalosis, B. Non-bilious vomiting, C. Jaundice, D. Fever. It is metabolic non-bilious vomiting. Gallstone impacted causing intestinal obstruction is A. Reynolds pentad, B. Hepatitis, C. Gallstone ileus, D. Obstructive jaundice. It is gallstone ileus. Hemorrhage after thyroidectomy is due to A. External carotid artery, B. Internal carotid artery, C. Superior thyroid artery, D. Inferior thyroid artery. It is superior thyroid artery. Anal pressure is diagnosed by TRUS, colonoscopy, clinical examination, barium ring. It is colonoscopy. 70-year-old female with bleeding from proximal colon. The diagnosis is A. colitis, B. polyp, C. diverticulitis, D. CA colonitis, CA colon.